think will be the reaction of members of ACP, and what message do you have for those members who aren't in agreement with this new policy?
Well, we certainly hope that our members would read the policy and remind them that we're not advocating changes in U.S. immigration laws, and that certainly is outside of the expertise of the American College of Physicians. But we would like individual members to note that there's certain basic tenets that that we feel as professionals we need to consider. For example, if a patient is going to be scared before they come to see them, they're more likely to visit the doctor sicker with a condition that might have been treated much more effective earlier, and we just feel that overall there are many different advantages to having a coherent national strategy on health care to immigrant populations.
And what are the next steps that ACP plans to take on the Hill to advance this?
Well, we certainly understand that this is a hot button issue and certainly needs to be seen in the context of Congress not being able to deal effectively with immigration for a number of years. But in particular, we think the case is very solid for having a national policy on health care for immigrants, that we will communicate that to members of Congress and to the administration and remind everyone that it's really in the general national interest to do this.
Why is a national policy so important rather than leave it up to the patchwork of states that address this issue?
Well, just having different approaches that often may not be carefully thought out, or even having understanding within the immigrant population. If, for example, someone in California had tuberculosis, and even though California law did not allow their physician to report them or did not demand that the physician report them to the authorities, the particular immigrant population may not fully understand that because they may have heard of it happening in another state. So we certainly feel like having a clear policy and having a sound policy would make us do a better job. And we certainly understand in the example of that case of tuberculosis, if someone even though they wouldn't have been turned in, delayed going to the doctor for a month and exposed 100 people to tuberculosis, that not only has harmed that individual, but also has harmed the other 99 people who might not have been exposed had there been a rational policy on this nationally that was communicated everywhere.